blood here. There's a streak of blood here. There's a streak of blood here. There's a streak of blood here. So it will lead you on to the place where the epistaxis is coming from. You understand? So that means it is coming from definitely the middle meatus from here. Okay. So that is the clear-cut place. So now where do you look for bleeding sites? So Professor Aldo Stamm keeps telling, look at this site, look at this site. This site is very, very notorious. See here, middle turbinate, medial to the middle turbinate. Give me an elevator. So just above the anterior edge of the middle turbinate. See here. Here is a very, very usual site of epistaxis. That is where the septal branch of the anterior ethmoidal artery comes here. And that's a very, very common site for epistaxis. And this is that is one site. Second site, of course, is from the sphenopalatine artery region. You take a CT scan, you see that there is no, tumor. Then you can go in for what is called the sphenopalatine artery ligation. So I'm going to suck that blood now. I know it's from the sphenopalatine artery region. So how do you do a sphenopalatine artery ligation? You also inspect the inferior meatus for any small telangiectatic nodules. So we always examine the inferior meatus as well, always. So look whether there's any telangiectatic nodules. So this I have seen in many, many cases, some small telangiectatic nodules causing epistaxis. So it is not there. So I have examined all the areas, and this is the trauma produced due to the packing. Don't bother about that. Now what I will do is I'll do the sphenopalatine artery ligation. So before that, I want to examine the sphenoethmoidal recess also to look for the septal branch of the sphenopalatine artery. See, that's the septal branch of the sphenopalatine artery region. That looks normal. So I'm very sure now that if I ligate this SPA, this patient is not going to have bleeding.